This is my camera. Let me know when you're ready.
This is mine.
2,
Call me.
1.
Hey guys, welcome to Triggs Table Talks. I'm your host, Dr. Wilton Triggs, and today I have two special guests. Like I say, all my guests are very special, but for my surgery patients, potential surgery patients, or plastic surgery enthusiasts, I have my coordinators back. Well, Amber back, and then I have Gabby, my other coordinator here. But not only are we going to talk about like coordination and all that kind of stuff, we're going to talk more about their journey into plastic surgery. Gabby's had plastic surgery before, but she's been operated by me twice, and then Amber just recently had surgery, and they both healed up great. So now we're going to get like a unique perspective from going from coordinator to surgery patients. So this is an episode you definitely want to check out. And like I said before, like, click, subscribe. If you like this content, share this content to those that may be interested in surgery or, just, getting prepared for surgery. So with that being said, Amber, Gabby, welcome to Triggs Table Talks. Well, I should say welcome back.
I'm so excited.
We're jumping in. Gabby, we finally got you on the show.
Finally.
20
You
years
guys
later.
let me out last
Are you
time.
excited?
I'm super excited.
Good. I get on Gabby's nerves all the time. So
Yeah,
this is
he
great.
does.
So it's got to be a little bit different now because most of my patients, they don't really see me every day. You know what I'm saying? So make sure they're doing what they're supposed to be doing. I was on their butts the whole time. I even went to one of their massages. It was very uncomfortable. And then I left. But no, now we're finna just jump into it. So I'm going to start with Amber first because this is probably the biggest question. What made you decide it was time for surgery after you reneged multiple times?
Okay, so working at plastic surgery, I always say is so toxic because you
very
feel like
toxic.
either I need to be in the gym every day of my life, or you feel
Or I
like,
need to have surgery.
or I could just get surgery because you're just
Exactly.
here. And seeing everybody have surgery constantly, I feel like you become desensitized by it. And so I was just like, you know what? I was going to the gym, but I wasn't seeing the changes that I wanted as quickly as I wanted. And I was just like, all right, I'm gonna do it. I'm gonna just do it.
It took a lot of work for her to get surgery. That was years in the making.
I've
literally.
been working here for 3 years, and now was that I
Now.
finally made it
Wow.
through.
Took you long enough.
It really did. We had to reschedule Amber multiple times, and it
That's
was
a lot.
always an excuse.
And we had to talk her into it so many times.
I think I would bother Gabby and Dr. Triggs about my breast augmentation size every day of
God.
my life for like 2 months. So now I feel you guys as my patients, okay?
Now you have like a unique perspective. And then Gabby, it was like, when can I have surgery?
Yeah, I can have surgery as many times as you want me to have
See,
surgery.
Here we go. But you handle it like a pro. You're a very good patient. I don't know about Amber as much, but very good patient.
was.
Yeah. So the first surgery was a little bit more complex. We replaced your implants, did a lift.
Yes.
Did we do lipo at that time?
Actually, no, I've had 3 surgeries with you already. I did my BBL.
Yeah. Okay.
Then I got the second round breast lift.
Yep.
And then
Yeah, just lipo, right?
and then just lipo.
Yeah.
Okay, and Gabby, how old are you? Because I feel like everybody needs to know
I'm
this.
24.
Okay.
Yeah.
So
She's a
you're
young
you're not too young, and you can get surgery whenever you want.
Exactly.
basically, if you're healthy. If you're healthy.
exactly.
And so when did you decide that you wanted to go back and do the lipo? Because we had already did the BBL, and the BBL looked great. You always get compliments. People use you as a wish picture. So when did you know you wanted to go back and do lipo? Because you're a gym girly too. You go to the gym. You eat really healthy. You eat healthier than
I
me
try.
and Amber. So,
I haven't gone to the gym
especially
in a while.
Amber. She's a big bag.
But I will say, you know how you can only take out 4 liters?
Yeah.
I did have a little more fat on my back that I wish I would have taken out on the first round, but I couldn't. So, yep. I decided that it was time to finally.
It works out.
I feel like in Gabby's first round, she achieved like the shape that she wanted as far as
Definitely.
like her butt and everything like that. And then after that, I don't know. It's like once people have surgery, they feel like, oh, I could tweak
I could do
this.
this.
I could tweak that. So yeah, then she was like, all right, I'll perfect it on my second round. And this time around, Gabby didn't even get a BBL. She just did lipo, and now her butt looks
It's
even
10
bigger.
times bigger.
Her shape is way nicer. So sometimes you think you might want a BBL, but lipo
don't.
might just do the trick.
Yeah. So, sometimes I think like if you really just don't have anything, yeah, maybe a BBL is the way to go. But if you have a little bit of something, a little bit of curves, I think lipo. You should just start with lipo. I feel
Yeah, I
like.
would have definitely made a mistake if I would have gotten the second round BBL.
But I
It would have been way too much.
but I also understand like wanting to tweak things. So I had Invisalign for my teeth, and my teeth were already pretty decent before I got Invisalign. And then I noticed like I don't like how this one tooth looks, and I'm like sitting there like I feel like going to do it. And so I talked to my dentist friends, and now they're looking at me crazy because they're like, like, no, your teeth are fine. They almost look like veneers.
Yeah,
Yeah, your
And
teeth
are
are
literally
perfect.
And so now I'm over here like, no, but I just could tweak this just a little bit. So I can only imagine.
Yeah.
Like,
and working here is 10 times worse. Like,
Yeah, because we see all the patients before and after photos and we're like, oh, she looks so good. Should we do that?
Should we do that?
Yeah.
Should I do a little something here? Yeah.
Yeah. We're crazy. I think now looking back, we're kind of crazy, but
we
we're
are
not.
crazy.
So do you think being a coordinator helped, or did it make you like give you anxiety or make you overthink about everything?
I mean, for Amber,
Oh yeah, when it came to the labs and stuff.
when it came, oh God, okay, sorry. For Amber, definitely, I think she was more nervous because, I mean, I already had surgery done before I came here, but she hadn't. So seeing the anesthesiologist every day and the patient's labs and things like that, that definitely made her more nervous than any other patient, I feel like.
Yeah, so every question that comes to mind, you just have the freedom to just
go.
ask a doctor or ask an anesthesiologist every single day. So it's,
That's what you did with Ashby too, right?
Oh, yeah, guys.
Shout out to Bernard.
I'm 20. Yeah. Shout out to Bernard Ashby. Okay. That's my cardiologist and Gabby's and Triggs.
Yeah.
My whole family, I think, now too.
Yeah.
But yeah, I'm 26 years old. I obviously probably didn't really need a cardiologist clearance, but I still had to run by everything by a cardiologist just to be safe on the safe side. And I feel like working here makes you think like I want to be extra cautious and double check. Whereas a lot of patients, I feel like they don't really want to go the extra mile and double, triple check just to make sure they're healthy.
And
kind
they
of
don't.
just,
They don't see
Honestly.
the importance of having everything in check, all your labs, everything in range, everything that we ask you for. Like, some patients think we just ask for things to ask for things, and
like for
we're
fun.
asking for it because we're trying to take care of you.
Literally,
we want to make sure that everything is,
safe.
Safe.
Like, I want surgery to be as safe for you as it was for me.
Exactly.
So I don't want to have the doctor or the anesthesiologist have absolutely any doubts about you. I'd rather everything be like, oh, do you think she might need a cardiologist clearance? Just make sure everything is clear before you even come.
Exactly. Do you think you were annoying during this process?
Oh,
definitely.
she definitely was.
100,000%.
Especially when it came to those implant sizes.
Every day. No, you didn't even get the half of it.
No.
I was in the office with her all, Gabby, but do you think I should go this size?
But SRX?
But like this
but
size?
SRX?
Or
But
every
moderate
single day for about 2 months. I'm not even joking.
Yeah.
Yeah. When she finally decided she was going to get her surgeries, that's when she really...
How many boobs did y'all look at in between?
Oh.
Because it was like months ahead of time.
Every single breast dog you did, we looked at. Every single one.
Yeah.
Oh my gosh.
Yeah.
Pretty much.
Terrible.
Sorry.
What did y'all friends and family think?
My mom thinks I'm crazy.
Yeah, her mom thinks we're
But
crazy.
she's so chill though.
She is chill, but she thinks I'm crazy. She just... When I tell her I'm getting another surgery, she's
like,
like,
you guys are bored.
Gabby, another one? I'm like,
For
"Mom, I
me,
work there."
my mom is like, yes, do anything you want to
Oh my gosh.
do. Yeah.
Yeah, my mom definitely thinks I'm crazy.
And surprisingly enough, my dad is like I wouldn't say super supportive, but
Yeah.
he's not opposed to it. He's like, whatever you want to do, do it.
I definitely thought your dad would be a little bit more, but I guess with your mom's also had a couple surgeries.
Yeah, my mom has had a couple of surgeries too, so I think he's used to it already. He's like, girls.
And then the easy question is, were you loud and proud about it, or were you really quiet about it?
I was loud and
I know
proud.
you
I
were.
was very loud and proud. I didn't hide that for
It
anybody.
was like it was circling days, like it was Christmas time
Once-
coming up.
Literally, once those 3 months hit, I was
What was it? December 19th?
December. That was when I did my breast. No, but when I first got my BBL was
it June?
the end of summer.
Yeah, you were
So-
upset
It's
because you were
bad that
inside.
I was inside the entire summer.
I still remember that date because that's all you talked about. It's almost that time. It's December.
It's December. Yeah.
Yeah, it was terrible.
Gabby's one of those people that literally, she's like, I'm getting surgery. And she's hopping up and down for like weeks.
Yep.
Yeah.
When she got her surgery, I was like, no, I need to get I got my surgery after hers. And I was like, no, I need to do my other surgery. I can't wait. I
We're
literally
like
was
2
going...
weeks apart.
We're 2 weeks
So
apart. I
can you
couldn't
guys
wait.
imagine we're in an office together with our fajas on, boards, foams, hot,
Sweating.
tired,
Mhm.
annoyed.
Tight.
We would complain together
Horrible.
every single morning. It really helps having somebody that's going through the exact same process as you because you don't feel annoying. But I can imagine with my family and my friends that don't have surgery, we're like, oh my God, Amber, shut
Our
up."
boyfriends.
Yeah, God bless.
Oh my
No,
God.
literally.
Sweating on our
Strong men.
faja. Horrible.
Strong men.
Guys, yeah, the faja.
That faja was
Yeah.
was
that
no
part.
joke. If you guys if you guys can put on your own fajas, it's not tight enough. I'm telling you that right now, it's not tight enough.
1,000%.
Mm-mm.
We'll get to that. The sizing down.
Shout out to those guys because that's crazy.
Angels.
Angels, they really are.
So do you see why people like do the whole surgery sister thing now?
Yeah,
Definitely.
I think you definitely.
Because sometimes it's so hard to schedule them because sometimes one person has problems or rides in the pickup. But now it's kind of like, okay, I can see why they want to come together and get it done.
And we feel horrible for them because sometimes one of them doesn't have any, their labs in range and they can't have surgery, and then the other one can. So then we feel really bad for them when they can't do it together.
Okay, just so you guys know, we actually do feel really bad when you can't have surgery.
Yeah, we do not want to cancel.
So sad when we had to cancel somebody. We get so stressed. Like, it's like if it's us.
Literally, if we're canceling
like,
our surgery.
God, can you believe Miss Bullock can't have surgery? Like, we get so invested in you guys.
Yeah,
and we get so anxious having to tell you guys about it. Like, it's so nerve-wracking because we know how you feel. We know what you want to get that surgery.
And we know that 90% of our patients come from out of state. So I know that you book your flights. We know that you have your hotel, that you have kids, you accommodate with family. Like, we know what goes into it. So it really does like stress us out when you guys are not there health-wise.
I think the biggest thing is you just really have to read those welcome text messages and emails and stuff like that. Because people are like, oh, well, I didn't really read that. I was like, it's in there. It's in there. Because I go back and read it just to make sure. Like, we hate canceling you guys because it eats up the day for us too. Like, it throws the schedule off and it just sucks. Yeah. So how was the night before surgery? It was like Christmas for you.
It was Christmas.
She thought Santa Claus was coming.
Amber, shaking.
I had 10 nightmares. I had every bad thought you could think of. And then finally, like the morning of surgery, I was like, let's get this over with. I'm ready to... I already done stressed out for so many weeks that I'm like, all right, I'm just happy to get it over with already.
She was so washed from constantly having to think about the surgery that she was just like, I want to get this over with already. Yeah. She could not wait to get it over with.
All right. So how was surgery that morning? Or how was the morning of surgery?
Again, Christmas.
Amber, she was about to cry.
I was happy because I wasn't going to think about it anymore. So I was just like, yay, I'm getting it over with. I remember my boyfriend looked at me and he's like, are you really going to do this today? I'm like, yes, let's go. Drive me right now. Like, I can't think about it. I need to get there.
I know that feeling.
She's very quiet.
Feeling. Amber, you sure you want to do this? Like, you don't really got to.
Triggs texted me the Friday before surgery and he's like, hey, so you really going to come on Monday? I'm like, are you serious? Of course.
After he's been harassing you for months to get your surgery.
Yeah.
Of course.
I was like, yeah, I'm about to have a free morning and everything. I forgot it's Amber's surgery.
Yeah, you were the only patient that they ever.
Yeah, it was very
rude.
But you also did it when everything had kind of calmed down. It's like the slowest part of the season, so
it was perfect. It was like I got surgery right before we got into like a really busy season.
Mm-hmm.
Yeah, that was wild. So I feel like my recovery was kind of like I was so focused on work, I didn't really have time to like be stressed about.
Yeah,
outside of just scheduling your massages and stuff. Yeah, makes sense.
Those massages.
No, yeah. Let's talk about those massages for a second.
Oh, we gotta hold off on
okay.
We don't leave that question. We won't scare everybody away yet. So what do you remember about going under?
Okay, so I was super scared of going under because I have never been under anesthesia before.
That's always, I feel like that's what most people are scared of.
And now, ladies,
that's the easiest part.
That is the easiest part of the surgery. I can't believe that I used to be stressed about going under because that was a blink of an eye. I can't remember anything. I remember my anesthesiologist, Stephanie, which you guys have seen on another podcast by now. She was like, all right, it's time for tequila. Let's go. And so she brought me to, okay. So then I think we're super close. So she carried me onto the operating table. And then she was like, okay, just relax. I'm going to take care of you. I'm not going to move my butt from here.
Amber was shaking at this point.
And yeah, I was definitely, the nurse took over me and I was like shaking all over. And then from 1 second to the next, I just closed my eyes and I woke up and surgery was done. I had no idea. I didn't wake up in any pain. I wasn't like, I guess naturally you tremble a little bit when you wake up, but nothing like super crazy.
Yeah, you weren't super shaky or anything.
And then my boyfriend came to pick me up and I went to go get an IV with Drip and Body. 10 out of 10 recommend. I feel like after that, I kind of got all my energy back and I felt way better.
Yeah.
You were doing well. I was like
jumping.
Yeah, I was really hyped right now.
I didn't even look like I had surgery. I was walking around.
I mean, we could tell you had surgery. I mean,
no.
You know
what I mean? Like, I feel like patients don't really know that you're actually very mobile after surgery. Like you can get up, you can walk around. You're actually supposed to be up and walking every hour after surgery to help you recuperate faster.
I would always tell Amber, it's like like literally taking a nap and you wake up with a new body. What's
Yeah.
better than that?
Exactly.
Literally, there's nothing better than waking up.
She's crazy and I'm normal.
Fine.
So you guys can relate with me.
She was shaking really bad. I was like holding her hand. She was
like, Gabby,
shaking. She's like, if you leave this OR, I'm gonna know about it.
No, and then Triggs goes, he's like, oh, I think something was wrong with your EKG right before I go to sleep.
Yeah.
He's psychotic. Who was the
terrorist? He's a terrorist.
He's crazy.
Yeah.
I was at that point, I was like, I don't even care if something's wrong with my EKG.
That's because you had that good stuff flowing through.
Yeah.
Steph was like, you're about to feel less nervous in about 2 seconds.
Yeah. Oh, side note, guys. Okay, maybe not. I have scrubbed in and been there in Gabby's surgeries just because we're like that with each other. I'm like, Gabby, you better not leave the OR. You better be. And if Triggs decides to put a big implant in me, you better tell him not to.
I was in there with Triggs. I was like, Triggs, that implant is too big. We need another one. We need another one.
Guys.
He loves the big implants.
Yeah.
Because after the swelling goes down, it's the first thing to say, oh, I should have went bigger.
No.
Okay, and for the record, I did SRF 220. And I was an
SCF.
SCF
225.
Okay.
SSF.
Yeah.
You're gonna have to cut that out. Yeah, SSF 220, and I was an A cup before. I would say now I'm like full BC. Just
You're definitely bigger than a B.
It's just that the shirt is tight, but they're really not. They're like
perfect for her body.
I think so. I think they're really proportional with my body.
Amber may look tall right now.
Yeah.
Amber's 4'9".
Yeah. I get. Oh my god!
She didn't want to be top heavy.
One of the patients and her husband saw me in the hallway, and they're like, "You look bigger on the videos." I'm like, "What?"
Bigger how? Like taller or
taller,
just? Yeah. Okay.
I thought I was way taller. They're like, "Oh my god, you're so tiny." Yeah.
Oh my gosh.
Yeah.
Who had like the funny, like crazy wake up story, like when they were in recovery?
Me.
What was going on
Gabby
again?
was singing "Sexy Red."
Why were you?
I'm not gonna sing the lyrics because they're a little vulgar.
Why were you doing that?
I was just happy I had a big butt. Honestly, that's all I cared about.
Can you imagine?
Which Sexy Red song was it?
Pound Town.
Just Pound Town.
Wow. Was this after the BBL?
Yes.
Yeah.
That's even worse.
She's crazy.
Singing Pound Town after a BBL is diabolical.
The only thing I remember, I was like, "Turn me around. You guys better not be messing up my butt results."
Everybody does. A few women do that. They be like, "No, I'm laying on my butt. Turn me on my side," or whatever.
Yeah.
Yeah, they get really mad about those. We got to make sure you can breathe first on your own.
No, all I cared about was my butt.
Tell them how long you didn't sit for.
I didn't sit for 3 months.
I remember.
Mm-hmm.
No,
even now, sometimes you like do like
I'll
chair thing.
Yeah, exactly. I didn't sit, not even on my booty pillow for 3 months. I did not.
Crazy.
I was like, Gabby, just sit. It's okay.
No,
She forgot how to sit.
I forgot how to sit. I was so scared to sit for the first time. I really was. I thought that my butt was gonna like deflate.
Paid off too. How much do you think your butt went down though, from like size wise, from all the swelling and stuff?
I'm not gonna lie to you. My butt didn't really change.
I didn't think so.
It didn't.
At one point, it did seem like it was smaller. You were like, "Oh my gosh, I need a second round."
Because
you go through phases.
I do go through phases, but because I didn't remove all the fat from my back because obviously I couldn't. So I definitely feel like my butt didn't look as big as it could have if I would have gotten more lipo on my back.
Right.
But again, 4 liters.
But I remember Gabby would say like some weeks she would feel like my butt looks bigger, my butt looks smaller.
Yeah,
my
I
butt
would
looks
be
bigger.
like back and
because
forth.
your body kind of goes through like you're swollen at first, so it looks super big. Then it kind of comes down. Then your butt.
Then your waist really snatches in.
So it's a lot.
And then it's like back and forth.
I feel like you can't judge anything in the first couple months.
Also, if you guys don't watch your mouth and eat everything, those results are going in the trash.
Yeah, absolutely.
I'm telling you right now, people think that after you get a BBL or a lipo, you can eat everything you want. You definitely cannot.
Well, y'all just said something. Talk about like the fluff, because people they'll mention it, but no one like really talks about like, oh, like I'm just waiting for it, the fluff or the fluff fairy or some.
I'm not gonna lie to you. My butt was soft after a month and a half. My butt didn't take long to fluff at all.
I think it does have a lot to do with how small the patient is, right, Triggs, and how much like stretch they
have in their skin.
Because obviously somebody did a lot of fat and they had a small space.
It's going to take a
while.
It's
going to take a little longer.
Yeah, it definitely depends on your skin, on your elasticity. It depends on a lot of things, honestly.
Yep.
Yeah.
That's crazy. All right. So Recovery Chronicles, what are some of the biggest surprises you encountered during recovery?
Okay, so my biggest surprise was my second round because I will say that for my first round, I had no pain.
Yeah, she's
I
crazy.
was on a cloud. I think I was so excited that I had gotten my butt done and that it came out so good that I didn't feel an inch of pain. My massages were a breeze. Everything was just.
I was at Gabby's massages and she was like,
I was
nothing.
laughing, joking
Yeah.
around.
I can't relate to that.
I kept telling her, I was like, Amber, you're gonna be okay. Nothing is gonna hurt. Like, you're gonna be fine. Until I got my second round.
But
They
it
do
makes
say
sense
that.
though, because you have scar
Yeah.
tissue from the previous
Exactly.
lipo, and so yeah, things.
I was
The second
expecting
round's
it
a little
to
bit
hurt
rougher.
more, but
Yeah, it's a little bit
it
rougher.
definitely.
I would say for me, not so much that like it's not like pain like you want to cry, but it was just like like it's like an annoying feeling like you don't want to be touched, but you have to get your massages done for your swelling, for your results, to get your fluid
Your
out.
skin to stick, like
Yeah, and
it's a
it's
lot of
like
things.
after every day you look better and you also feel better, so it's like you're like I hate these massages, but I'm gonna still go though.
And a lot of people
Go ahead.
A lot of people think that you're in pain like all the time. You're
Yeah.
not. You're just very kind of little sore. The faja's tight, so you're a little uncomfortable. You're only really in pain, and I wouldn't say it's like the worst pain in the world during your massage.
Yeah.
Like it's just that 1 hour during your massage, and then afterwards, every time you get a massage, you feel 10 times better.
Right.
Every
And
single time.
does it eventually start to feel like easier to go through as time goes
100%.
on?
Yeah, we were gonna
After
say that.
Your seventh?
After my 7th massage, it was like significantly better than the first week of my massages. Also, not to mention, Gabby and I never took any pain medication. Like we didn't take
all.
Percocets, like no narcotics. We only would take Tylenol. That's
Yeah.
really the only thing we needed because the pain is not like anything that you
doesn't
can't
mean
handle.
That doesn't mean you don't have to get your medications.
Yeah, you still need your
You still
Percocets
gotta get
because
'em.
some of y'all.
I'm not gonna name names.
No, but for real, get them just in case.
Yeah,
Literally.
exactly. What about because you did carboxy? Tell them about that.
No, we did cavitation.
No,
Cavitation.
We did
Cavitation.
cavitation, did wood therapy. It's all I feel like
I am getting carboxy now after
Yeah.
I've been fully healed. I do want to get that now. But as far as cavitation,
it's fine.
it's
I feel like
better than getting a massage. honestly.
100%. It's like the first week of massages, you're like in that like swelling pain. Then the second week, it's like it's significantly better. The third week, you kind of start going into like the molding phase, whereas you're done with fluid and now you're starting to
Your
contour
faja.
more
Yeah.
and be tighter in your faja. So it's all different types of discomfort that you go through. But honestly, it was worth it.
It was. I would do it again. But
I know you would.
So knowing what you know now, what would you recommend, or what would you do different in terms of like recovery wise or post op wise? Whether that's diet versus how you do your massages.
definitely my
like-
diet. Like
Mhm.
definitely the first time around, like I said, I thought
Got
that
comfortable.
lipo means I can eat whatever I want. You definitely can't. And the first couple of months, I will say you will lose weight. Especially if you have a good diet, you will lose a lot of weight. But yeah, definitely keep your diet in check because your results
Yeah,
don't do nothing with
exactly.
a horrible diet.
Yeah.
Something I know now is the importance of the faja and sizing down.
Definitely.
I was literally sizing down my faja every 3 days. And by that, I don't mean not only buying, like, let's say I started out in a small and I went down to an extra small. I would be getting my faja tailored. Like, you would have to take it to a tailor to get it taken in on the bottom to make sure that you're like compressing the amount that you need to keep your swelling down, which is the most important part. And I feel like my waist and Gabby's waist, I think we've gone down like at least 6-7
Yeah,
inches.
we were struggling in those fajas. Those
Yeah.
fajas, we were
You
struggling.
drop a pen on the floor, I can't get it.
It was staying there for the rest of the day. It wasn't going anywhere.
And we wore our boards for 3 months.
For 3 months.
Like consistently for 3 months because you're like the way that your abdomen just heals straight, like flat. I think
And you've been more than 3 months and you're still wearing your board.
yeah, I still whenever I put my faja on, I just wear my board just because I don't know.
It just
I'm-
we
you're
got
just
used to it. Yeah.
Yeah, it becomes one. Like your faja is your second skin. You actually feel weird outside of your faja.
Yeah. Yep. I think that's a good point to raise up too. Like all these things, like, unfortunately they cost money. So if you really want the best result, you really got to set money aside for post-operative care, whether it's
100%.
massages, cavitation, the different fajas. Like eating healthy is not cheap either. So
It's
you
not.
got to set that aside too. So it's kind of like you have to really like think this thing through. I think a lot of people like jump in. It's like, oh, I'm wake up with a new body, but you got to maintain it. And if you want to enhance it to the best its abilities, you got to really, you got to pay to play.
And we work here.
Yeah.
And it was expensive.
Yeah.
Can you imagine?
Imagine flying out of state,
Yeah.
lodging, hotel, everything.
More of the story,
it's expensive.
Though. If you're going to do it right. Like, save up the money and, like, get your massages, take in your Faja, buy as many as you need to. Because you already went this far. You might as well get the results that you wanted out of it.
Exactly.
Like, Gabby and I get so frustrated when patients come here and they're not fully prepared, or they'll say that they're around their last dollar and they're not able to buy their next spa. And it's like, girl, this is your results, nobody else's. You have to take care of you. So make sure that you really allot the money that you need to for surgery.
Yeah,
definitely.
sure.
How much would you say we spent in post-op? I would say like
thousands.
$2,000 after surgery.
And we work here. That's another thing. We live here in Miami.
Yeah.
Like, imagine you guys are coming, you guys are paying flights, hotel, massages, nurses. Like, it's a lot. You guys cannot come here by yourselves either.
No.
Like, you guys come here by yourselves. I mean, we won't let you have surgery if you're here by yourself, first of all.
Yeah.
So,
or like surgery sisters thinking that they can take care of each other.
Yeah.
No.
Oh, yeah.
No, you need someone else.
Right.
We're okay with you guys coming together. That's totally okay. But you guys need someone to take care of both of you. And no leaving in Ubers.
Please,
Yes. Oh,
please, guys.
No Ubers or taxis or lifts or anything.
The Ubers actually don't want you in their Uber.
Exactly.
Because you are going to be draining after surgery. So imagine getting in a person's car without any of like the wee pads and stuff to take care of their cushions.
I mean, that happened like 2 or 3 weeks ago. A patient, I was doing like her pre-op, and she was like, yeah, so will I have my phone to be able to call the Uber? I'm like, call the Uber for who?
For who?
Like, where are you going? Yeah, this was like a couple of weeks ago. I'm like, ma'am, no, you have to have someone taking care of you. You're having general anesthesia. And so I don't know, like, I guess because there's a lot of misinformation out there, but I think it's supposed to be kind of a common thing to kind of know, like, yeah, you can't do these things, but you'd be surprised. Like, people just do not know. And I don't think she was trying to
she was
get over anything.
She just didn't know.
I think she just really didn't know.
Because if she was really trying to get through, and she wouldn't have told you anything.
Exactly.
Yeah.
Exactly. Any emotional roller coasters during this process?
Definitely. 100%.
Should we talk about your sister? Should we talk about Erica?
Oh my God, her sister?
Okay, no, I'm gonna talk about me first. I definitely, I don't know, have you guys heard about post-op depression? Like, you go through so many like changes within, like, guess your hormones. I was definitely crying on day 5. I was crying my life away. I don't even know why, guys. I had no reason to cry. I wasn't in pain, nothing. It's just like you're just emotional. Like, your body's going through a change. You're going through a change.
The thing is, you look at yourself the first day and you're like, oh my God, I look horrible. You're not going to look like that in about 2 weeks.
Yeah.
Like, at all. Like, you just keep going. Like, I look good today. I look good. Like, tomorrow I'll be more swollen than I was yesterday. Like, it's literally a roller coaster of emotions.
You have to trust the process.
You do.
For sure.
You do. We definitely do.
Wait, what was the question?
Oh, Erica.
Yeah. Okay. My sister, guys. Erica, I'm sorry in advance.
We love you.
We love you. But my sister, okay, if you're naturally already an emotional person, I promise you that surgery and anesthesia is just going to heighten that times 1,000. Erica would just be crying every day. It was
every
funny
day.
At some point. Gabby and I were like, girl, what are you crying about now?
She would get in her head about her massages.
Everything.
Anything. She wouldn't talk to us. She would be like upset in a corner, just...
Oh my God, I'm about to get a massage.
I did this.
And then after, it's like the dopamine hits and she's like, I'm so happy now. The sun's shining.
Yeah, because her results look really good.
Oh, Erica looks amazing, but it's normal if you go through like your emotional...
You're going to go through
roller coaster.
You are.
For anybody.
When did you say, when did you know when you looked in the mirror, it's like, oh man, I'm glad I did this. I did that. Or I'm a baddie now. Well, I'm sure you already say that, but yeah.
What can we say?
I mean, for me, the first time is that it was such a drastic change that from the moment I didn't care that I was swollen.
Yeah, because in Faja, you can see like...
Exactly. I didn't care that I was swollen. I didn't care that I was bruised. I didn't care about anything. So I was excited from the jump. The second time around, I think about like 2 weeks. 2 or 3 weeks is when I was finally like, okay, wow.
Because the first 2 weeks, she was like, oh my God, I'm swollen. Oh my god. This is for me, genuinely the first like
The first day was
3,
crazy
4
for
no, the
you.
first 3, 4 weeks, I was like, I don't recommend this to anybody. Nobody should ever do this. Like, I'm
Don't talk to
crazy
me.
because now I'm like, everybody should get surgery. This is crazy. Why didn't I do this sooner?
Literally. But yeah, I would always tell her, I was like, Amber, you're gonna love it. You're gonna have so much fun. She was like, I hate you, Gabby. I'm never listening to you again.
It's that the first couple weeks you're in your faja and you don't look cute in your faja
You
yet. You know
don't.
how people wear clothes and they look cute with their faja under? No.
You don't.
You have a board, you have foams, you look like a turtle, honestly, and you're just
do look
tired
like
of
a
like
turtle.
looking like a turtle. Your hair is not done, your nails are not done, you look crazy, you feel bad. And then finally when you can like get back to reality and start wearing your faja without the boards and foams and you start to see your body looking like snatched, that's when you're like, okay.
Yeah, and I
okay.
will definitely say lipo is 10 times easier than BBL. Like you can lay on your back, you can do so many things you can't do if you get a BBL. Like she was saying, you can't do your nails, you can't do your lashes, you can't with a BBL you literally can't do that. Well, I didn't do that for about 3 months. So I was going
Really?
insane. Like the depression really does hit. Like it really does.
So all right. So when was it when you got your first compliment from y'all's boyfriends, and how did it make you feel when you got it?
Okay, so Wesley didn't see me like since surgery. My mom was taking care of me my first week. So Wesley didn't see me until about like day 7 or 8. Actually, that my mom was gone and now he had to shower me and like stuff like that. And he was like, "Wow, like your shape looks crazy." Like, and he really liked it. And I was like, I was so annoyed. Yeah. So I think about like the first week and I was like, I
No,
was excited.
for me, like I was very swollen because it was my second round. You know, you have a lot of scar tissue. I was
Yeah.
very swollen. I think at first I was like, why did I even do this? Like I literally look the same because you can't tell. I think after like 3 weeks is when he was finally like, wow, babe, like your waist, like
Yeah.
everything was just like amazing.
Yeah.
My
Did you
butt was
believe
looking
him though?
bigger.
Because sometimes, in the back of your head, you're like, no, I still feel rough, so I don't believe him. Or were you like, oh yeah?
At first I didn't. At first I was like, he's just trying to be nice because I was so swollen.
Mm-hmm.
And then afterwards I was like, everybody was like, Amber would tell me that my
No,
butt was
all of us.
bigger.
Yeah, all of us.
And like Liz would tell me my waist was super small. So then yeah, that's when I started really believing it, and I was like, okay, it made a
Yeah.
difference.
Yeah.
Because I remember you even told me you were like you didn't have any fat at all in
Yeah.
In
the
the
front
front.
side.
Yeah. It was all back.
It was all on the back, like
Yeah.
literally all on the back.
So going through this, how has that made y'all like better coordinators, you think?
I feel like we're more empathetic.
We are.
Yeah.
Because before
definitely.
we're like, oh my god, they're crazy. They ask 20 million questions, the same thing over and over. They don't read anything, and now we're like, oh.
Aw. I'm like, I just did it. You're gonna feel great.
Yeah,
It'll
now
be
we're
amazing.
like, no, you can go back to work in 2 weeks. We're back at work in a week. Like, don't worry. But what do you do for work? And then we're like getting closer with them.
Yeah.
Mhm.
Yeah.
That's good. That's good. So let's see what they tell that pastor. Oh, so what would you tell Amber that reneged like 3 or 4 times, earlier on now? Go ahead and do it?
Yeah.
Or
Yeah.
like, oh,
I would be like, I should have done this way sooner. Like, I
Mhm.
wouldn't even have thought twice about it. Because
Yeah.
really, what I would think about all the time was more so because I knew what your results look like because I see them every day. I would just think about the anesthesia. The anesthesia was the
Yeah.
anesthesia. Like, that's the part that really kind of gets people in their head. But now that I know the anesthesia was like a blink of an eye, and I know like how good the providers that we have here are and things
Yeah.
like that, I wouldn't even second guess it. I've had my family get surgery here, like my sister, a cousin, friends, and like I'd tell everybody to do it, and I would tell myself to do it again and sooner and not think about it.
All
Like,
right.
yeah, you guys have to think about it. We are risking our own lives.
Yeah.
Like you guys shouldn't even be scared. We work here, we
And
know,
uh-huh.
and we're doing it. So there's no reason why you guys should be nervous or anything like that.
I always say
because-
that I wouldn't work anywhere that I don't feel like I trust, like the surgical team
Exactly.
or
Yeah.
like.
Yeah, trust the
Like,
product basically.
No, I
Right.
could not. I would feel so bad, like convincing somebody or like working with someone to like get their surgery, and I don't know the outcome. Like,
Yeah.
no, I love working here because I know that I'm like, you're gonna be fine. You have nothing to worry about, and I wholeheartedly believe it.
Yeah, but what do you wish you told patients more, or information that patients got more from? Like something you feel like they should know more about that probably they're not really paying attention to after going through this.
Like sizing down the faja and the
Post-op
amount
care,
of massages.
definitely.
Yeah, I
The
think it's
post-op care is literally the most important part for the
Yeah.
results.
Another thing, which a lot of patients don't read, their welcome packet. You need to stop smoking.
Yeah.
You need to take your vitamins. You need to stop taking any medications that you're not supposed to be taking.
And they can always ask questions.
Exactly. Do your labs on time, which is
Yes.
very important for you to do your labs on time. We're very adamant about this because we give you 30 days to do your labs. Within those 30 days, you have time to retest. You have time to get things in range. You have time to get your clearances. If something's wrong, you get me? We have time to take care of it. So that's why when you're at your 30-day mark, that's when you should, as soon as possible, start doing your labs.
Since you know that your labs are due in 30 days, you shouldn't wait till 30 days to schedule your appointments, because we call you 45 days before, and that's when you should be, or like when you first set up your surgery, you know when are the deadlines for certain things already by your welcome packet and stuff like that. So having your appointments already preset, it's like, okay, I get my labs done at the 30-day mark. When I'm around 29, 28 days, I'll get my EKG and medical clearance with my doctor. Any additional clearance after that within the same week, and you're done. So by 3 weeks before surgery, you already know where you stand as far as labs, where you stand as far as clearance, and you're not worried about, I haven't gotten a response or anything like that, because it does get busy and we do want to respond to you as soon as possible, but we need your stuff in a timely manner to work with you.
Yeah, because I feel like with the lab situation, if you can get it done earlier in the 30 days, you can work with your PCP if there's any abnormalities. And I can understand, like, I'm just going to get everything done at Vixen. Yeah, it makes sense. But what if something comes back abnormal?
Then you flew here.
Yeah, exactly.
You guys are flying here. That's the thing.
The flights with what is that called?
Insurance.
With insurance. We always recommend this.
Yeah.
Get your flights with insurance, because you don't know if you're not gonna buy your flights last minute, right? So you're buying them, I imagine, before you do your labs. So get your flights with insurance. If anything comes up that you need to change it, you can wiggle it with the freedom to do so.
Hotel rooms, insurance.
With insurance. Always.
Speak to your recovery homes and see what is
their policy. Will they be able to switch you around and move you forward? Those are important things.
And I mean, and there's also, you hate to say that, but there's these packages where, like, say you do have a complication. Sometimes your insurance won't cover hospital stays or things like that. But there's outside of insurance policies where you can buy, and if something, God forbid, were to happen, you're covered from an aesthetic standpoint. And that's probably something we'll start promoting a little bit more too. You hate to bring that up, but it's still surgery.
Yeah, it's still,
anything can happen.
Exactly.
But no, like, I think, staying on top of your labs, try to get things done as early as possible is probably the best thing that you can do to get through this real smoothly. And you're not having to worry, because you already have enough to worry about, but knowing that your labs are done, I'm good. The only thing I gotta do is pay the last of my balance.
Mm-hmm. Sometimes the patients will be like, no, because you guys are telling me this last minute, and I didn't know about this. But yet again, you're turning in your labs a week before your surgery.
In terms of the clearances, exactly. Like, I didn't know I was going to meet this type of clearance. Exactly. Well, you guys, thank y'all for being on Triggs Table Talks, especially you, Gabby, coming through, breaking the fear. Yeah. So is there anything else you want to, like, let the viewers know, whether, if they have questions in terms of, like, coordination or thoughts on surgery? Anything?
Get your surgery.
Yeah.
Just do it.
Yeah, just do it.
Literally just do it. There's no if, ands, or buts.
10
just
out of
do
10
it.
recommend.
10 out of 10 recommend.
100%. And especially if you're doing surgery at Vixen or with Dr. Triggs and specifically.
Oh, I guess we got to throw a little shout out to Dripping Body too, or recovery nurses.
Yes.
Yeah, recovery nurses. 10 out of 10.
10 out of 10.
You're going to feel so much better in your recovery, because why would you want to get surgery and feel groggy and like stuff after, when you have the opportunity to feel better sooner?
How do you think Wes would have handled, like, you not having, like, post-op recovery?
I think he would have been more scared. He would have been.
I think he would have. Yeah, I think he actually felt relieved that right after my surgery, he wasn't just going to be alone with me right away.
Yeah.
Like, he's like, okay, I have somebody that has the knowledge that something wrong with her. They're going to be able to, be aware of what's going on, because he doesn't have any background knowledge on nursing or anything like that. So he wouldn't know the signs, what to look for.
Right.
So it would make your family more comfortable, you more comfortable.
My mom was just used to me. My mom.
You're another case. Guys, listen.
My mom's recovered me every single surgery. She's really recovered my cousin. She's
a thoroughbred.
Yep.
Yeah.